Hello, everyone. In preparing this episode, I reviewed several thousand publications on testosterone. This is the most challenging episode on the channel in terms of time spent. I've selected the most reliable and accurate methods to increase the main male hormone. We'll first discuss basic methods that can increase it by 20 to 50%, and then move on to advanced options that can boost it by 50 to 200%. I recommend taking notes, and at the end, we'll wrap up. One of the best ways to raise the main male hormone is through competition and the desire to surpass someone or something. Since testosterone is closely linked with dopamine and motivation, many people associate this with sports. Indeed, engaging in martial arts without excessive blows to the head or torn ligaments combines sport, weight loss, increased confidence, and psychological release, all of which will positively affect testosterone. However, we need to look at this point from a broader perspective. At its core, it's about courage, not being afraid to explore new horizons, facing challenges head-on, and steadily overcoming them. It's about being ready for tough times and viewing life as a competition where your main goal is to surpass yourself. Sometimes allowing yourself a break to recharge, figure out what you truly want, and gather strength. The problem is that our behavior is influenced by our neurochemicals and hormones. Lower levels of testosterone are associated with anxiety, depression, and poor health, creating a vicious cycle. Low testosterone leads to low motivation, high anxiety, and poor health. The lack of motivation and fear stop any desire for achievements or change, logically preventing testosterone from rising. This situation is also common in diagnosed depression. If someone has this condition, telling them to pull it together won't help. It's like urging someone to stay alert after 2 days without sleep. In such cases, doctors will typically prescribe antidepressants, and after a couple of weeks, when serotonin levels start rising, psychotherapy is introduced. Eventually, the person returns to normal. In the context of our topic, we can either increase motivation and reduce anxiety, which is something we often talk about on the channel, or boost testosterone so that the person can later independently desire to make changes in their life. At the basic level, I'd expect an increase of 20 to 50% initially, depending on how bad things are. The normal testosterone range for men is shown on the screen. Different units of measurement are used, but today we'll focus on how to help your body produce more of the main male hormone. Testosterone injections can increase levels significantly, but they suppress your body's natural production. One injection every 2 weeks will raise testosterone to 25 to 30, but athletes often get injections every 2 to 3 days to achieve levels far beyond normal. However, managing these injections requires careful monitoring to avoid issues. 8 months ago, a woman had both ovaries removed and started hormone therapy. Due to excess testosterone, her body began producing estrogen, which led to the growth of her breasts. As shown in a large meta-analysis, BMI and testosterone levels are closely related. If your BMI is 28, losing weight to 22 could boost testosterone by 20 to 30%. If it's 26, the increase would be about 15%. For reference, at a height of 180 centimeters and weight of 84 kilograms, your BMI would be around 26. Of course, there are nuances. One man might have good muscle mass with low fat, while another may have little muscle and a high fat percentage. But overall, this method is reliable, and the same correlation applies to adolescents. A study with about 1,000 teenagers showed a clear difference in testosterone levels between those with obesity and those of normal weight. In this research, doctors were concerned that there might be issues with primary sexual characteristics, but in the end, everything was fine. And for normal male development, testosterone is essential. It's no surprise that boys with obesity have 10% smaller genitals. Men make decisions, but for the purposes of this episode, I'd like to emphasize the importance of having a normal body fat percentage at any age. It's not just about motivation, muscles, or sexual potential. It's also about fundamental male and female physical differences. And in total, basic ways to boost testosterone. Competition and challenge testosterone is linked to dopamine and motivation. That's why striving to win, achieve, and overcome challenges directly affects its production. The key is to treat life as a competition with your past self. Exercise. Especially effective are combat sports, as long as you avoid injuries. Moderate to high-intensity training, and even simple walking. 12,000 steps per day can increase testosterone by up to 50% compared to fewer than 4,000. Weight loss. The lower your body mass index, the higher your testosterone. Dropping BMI from 28 to 22 can bring a 30% increase. Sleep, diet, routine. It might sound cliche, but it works. Regular sleep, a solid diet, and physical activity are the foundation of hormonal health. Zinc, 30 to 40% of men are zinc deficient. Even a small zinc supplement can double testosterone levels in older men. Adaptogens and supplements. Ashwagandha, plus 10 to 20%. Tribulus, mucuna, fenugreek, varies by individual. Luzea, stimulates natural hormone production. Try out 2 to 3 supplements and see which ones work best for you. Advanced level, plus 50 to 200%. At this stage, you need blood tests. The minimum panel, total testosterone, SHBG, LH, prolactin, estradiol. Managing estradiol. It's not just about raising testosterone. You have to track where it converts. High estradiol can lead to gynecomastia, mood issues, and blood pressure problems. Balance is the key. Pharmacology testosterone injections? Yes, they work, but they also shut down your natural production. This path comes with side effects and must be done under medical supervision. Conclusion. Low testosterone isn't just about libido. It's about energy, confidence, decision-making, and resilience. The basics are available to everyone. Start there. If you're ready, take it to the next level. Most importantly, don't fear change. Challenging yourself and moving forward already boosts your testosterone.